Good morning and welcome to the program. Today we're discussing new models for VA patient care here at the Fayetteville VA Medical Center. And today's guest is the Deputy Chief of Staff, Dr. Robert Cummings. Welcome to the program.
Glad to be here.
Thank you. We're so excited to be talking about veterans' issues and their health needs, which are so important to all of our veterans. I hear a lot in the news about patient-aligned care team. What is this team?
This is a team that's dedicated to providing comprehensive care for veterans. This is the VA's model for comprehensive care. The medical home is what this is called in other places. The medical home model has been around for perhaps 25 years, but it's never been adopted widely across the country because most private offices or smaller medical centers cannot staff in a comprehensive fashion to address all the needs of the veteran. So as this gained popularity in the VA in this past 8 years, the model was adapted specifically for the VA.
And that's a good thing. That's a great thing. We need to make sure that our veterans are getting the proper health care, and they are. We know that PACT stands for, it's PACT, and it has, each letter has a meaning. So what does the P stand for?
The P stands for the patient.
Patient.
So the patient, of course, is at the center of the model. Every activity conducted by the team is focused on the patient. So P is for patient.
Mm-hmm. Why is, patient-centric healthcare is so important?
The idea is that you respond to the needs of the veteran in a comprehensive fashion, rather than say, okay, I hear what your complaint is, I'm going to send you to Dr. X. I hear this, I'm going to send you to Dr. Y. The idea is that the team will manage in a comprehensive fashion all the issues and then get consults as needed.
Mm-hmm. I know each veteran is different, but what are some of the, common needs of veterans as it relates to health?
Right. The commonest things are, number one, the interaction with the nursing staff as far as screening the patient for visits, identifying any problems that the physician may need to address, time with other members of the team. The other members include, besides the provider and the nursing staff, includes the clerical staff that oftentimes has to interact with the patient. It includes a social worker, it includes a clinical pharmacist, and it includes a member of the mental health staff. All of those people working together, pharmacist, social worker, mental health, plus the patient immediate team, will handle all of the problems. So for example, the nurse calls the patient 2 weeks before a visit, has a series of things that they identify and work through with the patient. If any problems are noted, then the nursing staff can work with the provider either to deal with issues up front before the visit, special diagnostic testing, certain consults, or they can put in their action plan that the following things need to be done during the visit.
I like that. Everybody has a role to play. Each role is very, very important to the total health care of that particular patient.
Yes, each person makes up a comprehensive team. We have the physician, we have the nursing staff, the clerical staff assigned, and they all work together all the time. It's the same group of people, so they get to know the patients. And if part of the extended team, they have a clinical pharmacist, they have a social worker, and they have an assigned person from mental health. So that if they see a patient who is identified as having an acute situation that needs to be dealt with today, they leave the patient in the room, go down the hall, get the primary care mental health staff, bring them to the room, introduce them to the patient, and then the care continues.
Mm-hmm. A system that truly works. All right, let's talk about the A. What does A stand for in the PACT concept?
In the PACT concept, A is aligned, which means the team is aligned with the patient. They're aligned with the patient to be sure that the care is comprehensive and delivered in a timely fashion. The whole goal is access, quality of care, patient satisfaction. So those are the three goals that we're trying to accomplish for all the 67,000 veterans that we have here in Fayetteville that we take care of on a daily basis.
And that's what all patients want: quality care, caring staff. They want to feel important, and they want to feel a part of their own health care. I like the patient-centric concept, allowing the patient to be involved in his own health care. All of these partnerships, I think, will, in fact, make the patient feel better, but also may speed up his recovery.
No question. And we deal with that very seriously. We want the veteran's perception to be that of a valued customer, that they're valued by the VA for what they have done, and that we in turn are providing them with the quality of care and the access that they need.
All right, let's get to the C, PAC.
C is care. And the whole idea of this is that traditionally medicine has been functioning in what we call a repair shop approach. The patient comes in with a complaint, a symptom, or a sign, and the physician deals with that problem, and then the patient leaves. This concept is different. It's not just a repair shop, it's proactive management of the patient. Know the patient well, understand based on their age and gender, what do they need this year? What studies do they need? What consultation might they need? Deal with that patient with what they need in a proactive way. Hopefully keep them from having to come in with a sign or a symptom. Figure it out before it happens.
Individualized care, I think, is what they really are looking for.
Correct.
Each individual is different, each patient is different, each disease is different. So you try to make this a custom, you try to make this a tailor fit for the individual patient.
Absolutely. And if the model is applied across the board, that's what you get. You get proactive management. That's what will enable patients to remain in a good state of health that they can accomplish. You can't accomplish perfect health for everybody. You know, it's in the genes, it's in what they've done in their prior life. You've got to deal with that, but you can help them maximize or optimize what their potential is.
All right, let's get to the T of PACT.
T is team.
Team.
And it connotes that this isn't just one person taking care of you, it's a group of people, the same people from time to time that you're going to be interacting with, that you can learn to trust, you can learn to interact with, that you know how to communicate with. When you want to contact them, you can call them on the telephone or you can send them a secure message, which is what a lot of our veterans do. And the nursing staff or provider will communicate right back with the patient.
So you feel like these providers are like extended family members to the people?
Well, you would like to think that because they see each other all the time. Somebody might be in a panel for 10, 15, 20 years. We have physicians in our facility who've been here 25 plus years. So they may have had patients during that whole period of time.
Well, I think it's a wonderful concept. I'm so happy that the VA system and healthcare system is finding options that will really empower our veterans to maintain their health and to prevent certain illnesses. And I think this patient-centric concept is a win-win for everybody.
I think it can certainly be a win-win, and it enables the veteran to not only participate in their care, but to take a lead in their care so that they can ask the team questions. They can be involved in the decision-making process. This isn't the physician saying, well, you have to do this, you have to do that, and then everybody leaves. This is talking to the patient, making sure they're educated about the issues, educated about their medications, and they understand what their options are. and you help them understand not only the options, but what the pros and cons are for each of those options.
So it actually helps the doctors do their work better, I guess, because the patient is truly, really involved in their own health care.
That's true. And one of the things we keep in mind is that most doctors, nurses, pharmacists, et cetera, were not trained in this model. This is not something that they learned in medical school. This is not something they learned in most residency programs in primary care. So that you have to be sure in the whole process that you orient the new people coming in, doctors, nurses, and that's the reason why we have a PACT care coordinator who educates incoming people and makes sure that they understand the processes as well as the concept.
And the veterans are happy with this concept, and your team, you guys are happy with this concept, so it's working. We appreciate it. And I know the public, our viewers, we always want to know what's going on in the lives of our veterans because we all love and respect our veterans, and we want them to get the best of care. So that is why we wanted you to come on to explain how the VA system is addressing issues affecting our veterans, and you're doing so in a very, very powerful way through this particular program. And I know there's so much to talk about. When we come back, we'll talk more about technology, how technology is changing and how it's meeting the needs of our veterans, how the Fayetteville VA Medical Center is addressing issues here at home, and how veterans are getting the quality care. So we want you to stick around and we'll talk more with the doctor about these very important issues. We will be right back. Good morning and welcome back to the program. Today we're discussing veterans issues, health issues with Dr. Robert Cummings. He is Deputy Chief of Staff here at the Fayetteville VA Medical Center. And we're so happy to have you come on to talk about these important issues that are empowering and impacting our veteran community. Let's talk about technology. How is technology changing the way you partner with the veterans?
You know, technology has really become a keystone in healthcare. It starts with the electronic health record. The VA actually developed the first electronic health record in this country. A group of physicians decided that they really needed a better way to keep track of patients and share information. So they actually developed what has evolved into the VA's medical record system. It's since then been taken over by the technology staff, but it was developed by a group of physicians. So that the electronic technology begins there. It allows me, for example, to see a patient's record anywhere they've received care in the VA. If they've received care in Durham at the VA Medical Center, I can click on Durham and I can see what happened there. If they had care in the Boston healthcare system, I can click on the Boston healthcare system and see their care there. So it really is a powerful tool. Not only can we see what was written about the patient, we can see x-ray studies that were done, we can see operative reports, we can see lab tests. So it's really, in the VA setting, because we have 6 million veterans across 100 plus medical centers, we can see what else has happened to the veteran during their years with the VA. Additionally, the veterans have the ability to use My Healthy Vet to communicate with their team. So they can send an electronic secure message to their team. The team then can review the message, decide who needs to respond to the message, or who the message needs to be forwarded to, such as a pharmacist or somebody like that. to manage the issue. If the patient needs to be seen, they can be brought in that day or whatever date is convenient for the veteran. Another use of technology is what we call home telehealth, where we can actually monitor and work with patients in their home using the home telehealth. Another use of telehealth is where we have the patient in the room, we have a video camera, and on the other end, it could be 5 miles away or it could be 500 miles away, we have a care team. It could be a physician, it could be a geneticist, it could be some other kind of counselor, and they can interact with the patient real time. So that's a very good tool that the VA has developed, and it in centers that aren't as quite as comprehensive as ours, they can have their patients access care that's not available to them in their local facility.
Mm-hmm. So it's a lot of great things that the VA hospitals are doing that people may not have ever heard. That you guys are on the cutting edge of technology, and that you're actually talking with the veterans and finding out what they want in their health care.
Correct. And I think the My Healthy Vet concept, which is the secure messaging, has progressively caught on over the past 4 years. More and more and more veterans are agreeing to sign up to use that modality because they recognize that it's a lot easier. Mm-hmm. It's easier to send a secure message, just like we would send a text or a email to somebody. It's easy because they'll know they'll get a response, and then definitive management can occur based on whatever it is that they need.
Mm-hmm. In your opinion, as a physician, as a person in the medical profession, what are the roles of family in all of this?
The family is exceptionally important. We like to make sure that the veterans, particularly those with a chronic disease state, will have their family members or extended family with them on visits so that they can be brought up to speed both from what's going on, what's the treatment approach, what medications are indicated, what limitations there might be on the veteran, and what the family can do in an interactive way to work with the team to provide maximal care to the veteran.
Mm-hmm. So the family is a very important component to the system.
Absolutely, and we encourage the veterans to bring their families. You know, if it's a routine visit and a person's basically healthy, then that's probably not necessary. But for any other thing where assistance is needed, we encourage that.
Mm-hmm. I also understand that the VA hospitals are encouraging veterans to be proactive in their health care and learn about good nutrition, learning how to maintain their health, which is very, very important too, preventative measures.
Yeah, that's part of this whole proactive process that I mentioned earlier, in that we want to outline for the veteran, what can you do? We have classes, for example, on nutrition and weight maintenance. It's called a MOVE program. We have lots of educational opportunities for the veterans so that they can become involved in activities that will promote their well-being.
Mm-hmm. I think it's important. All of us need to take our health issues, very important issues to our health. We need to make that serious because our health is very, very important. That is us, our health.
You are correct, and it's one of the things that we try to get across to veterans is that they have a key role to play. I mean, they have to be proactive themselves. They have to ask questions. They have to be sure they understand the instructions for medications. That's the reason why we do certain things that might not always be done. For example, if a patient is discharged from a hospital, the team will call that patient within 48 hours to make sure, did they understand the discharge instructions? Mm-hmm. Did they get the prescriptions that they need? Do they know what medications and what doses they're really to take? If a medication, for example, was started in the hospital and it replaces a medication they were on before, did the patient stop the medicine they were supposed to stop? Because there are situations where they don't do that. They forget to stop the original medication. So we can pick that up at the time of that call. So we work with our nursing staff, and our goal is 100% of those patients get contacted between 24 and 48 hours after discharge.
Mm-hmm. And we are on location here at the Fayetteville VA Medical Center. And I would like to know, what will patients expect when they come here to this lovely facility? It's beautiful.
I believe that the facility is just a marvelous place as far as its environment goes. And there have been a lot of studies done in healthcare to show that the environment of care is exceptionally important. You know, people have worked on, you know, what role does a water feature play in making a patient and the family feel more comfortable? What's the effect of light? What's the effect of noise? All of those things become important. And this facility is very light, it's very welcoming. We've got wide hallways, high ceilings out in the public spaces, and yet in the clinical spaces, it's the traditional type of environment, but at the same time, it's an environment that works well for the patient and for the team. The teams have workspaces where all of the team members can be present in the same space. So they can turn to each other, ask questions, make decisions. They all have access to the exam rooms very quickly. And to go back to the issue of technology, they use, in most of our clinics, laptops so that they can move from room to room and workstation to workstation with their computers without having to start and stop and start and stop. So that's worked out well. And you know, all of those things about the environment also go back to what other things can we do for the patient. For example, we will set up group appointments, either for group instruction, group teaching, group activities, so that people can not only focus on their own issues, but they can share their issues with other veterans. And that's been shown to be a supportive peer structure. Mm-hmm.
Well, it's a nice facility. It's bright.
It is bright.
You don't feel like you're actually in a hospital because it's so bright and festive. And I think the atmosphere makes you feel better. So I think it's great. The new facility, or the facility here in Fayetteville, is really great.
It is state of the art. I think we're proud of the fact that we have not only the primary care, as I said, for caring for 67,000 veterans, but we also have all of the diagnostic services like MRI, CAT scanning, the various diagnostic equipment for cardiac patients, et cetera. So that we do have a very, very comprehensive approach that can be provided here, as well as operating rooms. We can do day surgery here. Patients are not admitted here, but we can do outpatient procedures here, outpatient surgery here. So that's another thing that keeps the patient centered on the facility.
Mm-hmm. We've enjoyed having you come on the program. We've enjoyed doing these series of programs on healthcare and our veterans. I think these are important issues that we need to continuously address. And I know the hospital is doing so much to empower our veterans and our families, veteran families, to make sure that all veterans get quality health care here at this center. When people think about the center, what do you want them to remember?
I want them to remember that this is a facility and a staff that's devoted to their care. And the goal, as I have said, is patient access. They can be seen here quickly. It's quality outcome, and it's patient satisfaction. We want the veteran to perceive that they are a valued customer.
Mm-hmm. A very holistic approach to healthcare. You can find it here at the Fayetteville VA Medical Center. The staff is great. The programs are many, many programs that impact veterans' lives. Health programs for women, nutrition programs, programs for veterans, homeless veterans. There are so many issues that are addressed here at the VA Center, and we want you to support your local VA Center today. That's all the time we have for this edition of For the Record. You go out and make it a super day. We'll see you back here next time.